Today's date is January 5th, 2017. We're here with Bernice, who came all the way down from Reading. Bernice has an interesting story. I may share this?
Sure.
Okay. You had a massive gastrointestinal bleed last summer, life-threatening, and they don't know what caused it. You even needed a unit of blood, and they don't know what caused it. And they did work you up appropriately, but they might have missed something called a Meckel's diverticulum, and I want you to get checked for that. But you also came to me for other reasons, which was you said you have left hip pain, right?
That's right.
And the pain was down here in the back area and coming down the side. And no one knew what that was either. You've been to a chiropractor, you've had some work done, and you walked into the door limping, right?
Very much so.
Very much limping, in a lot of pain, right?
Right.
What just happened?
Amazing. You numbed the area where the wisdom tooth is on the left lower.
Where it was extracted.
Where it had been some time ago extracted, yes. Asked me to stand up and walk. First of all, just sitting up and getting off the table was much easier. I walked with much less of a limp. You asked me to sit down. I sat down, much easier. And amazingly, when I stood up, I didn't need to use the handles on the chair. I just stood right up. And again, walked to the door, feeling like a pretty normal, there was still a little bit of pain there, but a much more normal gait.
You know, I'm kicking myself for not getting a video of you before we did that. I did not suggest anything to you, did I?
No.
You didn't know what was going to happen, did you?
No, in fact, I kept asking, so why are you numbing my tooth or my mouth? And you said, well, we'll see. You're
a master's in nursing, right?
Yes.
Okay, I want the viewer to know that. I may post this on YouTube.
Oh, dear. I need to preview it first, but yeah, probably.
Thank you. So let me see you get up and walk to the door now. And sit down. I'm even taken aback by this. I'm sorry I didn't get a pre, but what are your thoughts?
I'm amazed. I'm giggling because I can't quite believe it. But yeah, I'm walking much better.
Any pain left?
A tad.
A tad.
A tad of pain when I can still feel it. That it feels different than the other hip
right.
when I walk.
Would you say we're at 90% or close?
Close.
Close to 90%.
Right now, yes.
Okay. And I showed you something that had to surprise you. I showed you that tooth number, or that socket, that site, 17, third molar is related to the sacro-iliac joint. That had to come as a shock to you.
It was.
Yeah.
It was.
The other thing that I don't know is this is also related to the small intestine itself. And you also have a couple other sites, in fact, 3 other dental sites that are hollering. You've been to Dr. Jarvis, our favorite local oral surgeon, and you've got a problem in number 30, in number 18, and number 14. 18 is still there, 30 and 14 have been extracted.
No, 14 has been extracted.
14's been extracted.
30 is still there.
Yeah, 30 is still there. That's what I meant. 30 is still there, and 18 is still there.
Right.
And I hit them all. I said they're all a problem. Jarvis told you that they're all a problem,
yes.
right?
Yes.
But I found one more.
Yes.
I found 17. All right, so this is going to be the first place we start. 17 is probably, it could be, the cause of your sacroiliac dysfunction and your pain. And I would be happy if it is, because at least you have a cause that's treatable with appropriate dental care. That doesn't mean I wouldn't do prolozone. Yes, I would still do prolozone on the joint because I think you need it. I think that joint's taken a big hit over the years. But you've had this problem in that SI joint area for a long time. Somebody said they thought you damaged your sacroiliac ligament, right?
Right.
Well, it's the joint, at least on this evaluation with me, and I think it's coming from number 17. Isn't that interesting?
Very interesting.
Okay. Well, now that you've previewed the video, is it okay to post it?
Yes, it is.
Thank you very much. You're pleased with today?
Yes, with the results, for sure.
Thank you very much.
Yes.